Strong environmental regulation is vital for all of us, and what's vital about the EU environmental regulations, amongst many other things, is that they underpin trade. So they stop people from engaging in environmentally harmful activities in order to undercut or to make higher profits. And without them, we see, and I think we only need to look to the US and other parts of the world as an example, a race to the bottom on harmful environmental practices in a kind of ever-growing desire to undercut and to make more money. So the EU's REACH legislation, which governs chemicals, is absolutely vital. REACH stands for Registration, Evaluation, Authorisation and Restriction of Chemicals. Its main aim is to protect humans, wildlife and the environment from the threat of industrial chemicals, whilst not undermining the competitiveness of the chemicals industry.
So what is an endocrine disrupting chemical? They're substances that interfere with our hormones, the hormone system. In particular, they can interfere in negative ways with growth and reproductive functions. In women, some of the outcomes can be decreased fertility, ovarian cysts, complications in pregnancy, and breast cancer. I'll link to those. In men, again, decreased fertility, genital malformations, testicular and prostate cancer, another cancer. And then the non-gender specific health outcomes can be neurological disorders, Parkinson's, and a whole range of other cancers. And there are some real issues with particularly endocrine disrupting chemicals that are turning science on its head. The old paradigm of the dose makes the poison has been thrown out with endocrine disruptors. A growing body of research and evidence is showing that actually really small doses, really tiny exposures to endocrine disrupting chemicals can have a much greater effect than the higher doses, which is how we regulate currently. Find a safe level, well, a level a bit higher than that, that should be fine. It's not the case with endocrine disrupting chemicals. Every day we're in contact with thousands and thousands of chemicals potentially affecting our health. There is very little research done on how these chemicals interact, the synergies between them, how the effects of them can be increased by working a combinatory effect. And the regulatory system certainly doesn't take any kind of notice of that. So pesticides, are linked to breast cancer as endocrine disruptors, but as in carcinogens in their own right. They're linked to a whole range of different cancers. The most recent debate about glyphosate has shown it to be a probable human carcinogen with links to non-Hodgkin's lymphoma, various other things. And there are some groups, so where are pesticides seen? Well, they are everywhere. They're not just in agriculture. You don't have to live next to a farm to be exposed to pesticides. They're in every single person in this room. DDT, which was banned in the UK over 30 years ago, is within every single one of us. It's within children who were born after it was banned, who have never been anywhere near it. We are riddled with pesticides, all of us. It's in our water, it's in our soil, it's in the air, and it's in our food that we eat. It's sprayed in our towns. There are 41 different pesticides used on the streets and pavements, the schools, hospitals, parks and playgrounds where we and our children live, work and play. 41 different types. Just looking at the top 15 most frequently used in towns and cities, 6 of them are suspected endocrine disruptors. 13 of them are known possible or probable human carcinogens. And then when we move on to food, it gets even more alarming. Well, our report was mentioned earlier. We looked at the pesticide residue results for the fruit and vegetables supplied under the Department of Health's School Fruit and Vegetables Scheme. And the scheme has a very noble ambition, and that's to supply every 4 to 6-year-old at school in England with one piece of fruit or veg every day, to encourage healthy eating habits going forward and taking that forward into later life with them. And I applaud that, that's fantastic. But we looked at the pesticide residue levels in there. None of the food provided was organic, which would have meant there were no pesticide residues present. There are only 8 different types of fruit and veg, so we're not talking about the whole range of everything that we eat that is available. We found 123 different pesticides across that range of fruit and veg. 43 of those are suspected endocrine disruptors, and 52 were known, possible or probable carcinogens. And we're feeding this to 4 and 6-year-olds who are one of, if not the, most vulnerable group to the long-term effects, the chronic health effects of exposure to pesticides and endocrine disrupting chemicals. We also found out that for a penny per child per day, all of that could be provided organically. All of it. And it brings me on to what should the government be doing? What the government shouldn't be doing is listening to the people that make and profit from these poisons, which is their default setting at the moment. That is what they should not be doing. They should not be deregulating. What they should be doing is protecting us and the environment from the effects of these chemicals. That is their job, and they are being negligent.
Many people, myself included, would say that our health and safety system is broken. People would use ruder terms, beginning with F and ending with D. Those are people within the HSE. The health and safety system in this country is in an absolutely appalling state. Since 2010, we've had 7 years of sustained deregulation of health and safety law and enforcement. On night work, I just want to say breast cancer and night work is really, really important. It's something that nobody really wants to talk about because a lot of women work nights and people would rather pretend it's all due to our own lifestyle choices. A piece of research from somebody called Travis came out last year to say basically, well, don't worry about it, we've done a big study and we can now say that night work doesn't cause cancer. The only problem was very, very bad science. Unfortunately, Rory O'Neill at Hazard magazine did an absolutely brilliant job of going through it and talking to some of the best experts on night work and breast cancer in the world, and came back showing how this was actually wrong. But the HSE and the press and everybody immediately took this up. Cancer Research UK, all the little NGOs, they all took this up. They don't worry about this. Join us. We have to campaign for a Brexit that does protect the minimum standards and probably does worse. And we basically have to be fighting for our lives. We want safe work. It's not going to give us cancer, breast cancer, or any other illness. We want safe work, we want safe homes, we want safe environment, safe water, safe food. And we have to fight for it. It's fighting for our lives.
In 2011, the World Health Organization called an international conference in Asturias in Spain, and they seemed really determined to push the cancer prevention agenda further than it's ever gone before. The conference was on environmental and occupational determinants of cancer, and out of the conference came the Asturias Declaration, which was drafted there, and it called the prime prevention of cancer, i.e. stopping the disease before it starts, the single most effective means of prevention, saving lives and saving billions of dollars. And the Asturias Declaration called on every country to integrate prime prevention of cancer into all its cancer plans and strategies. Now, this was a watershed moment for me as I was sitting there hearing the WHO saying what we've been actually saying for decades. I felt really reassured, I felt we were validated, and it was a groundbreaking declaration. So I came home and I waited for the announcement from the government that they were going to put this in all their cancer plans. I scoured the breast cancer charities for, some news of this declaration, and actually found nothing. So I waited, and actually 6 years later I'm still waiting, because none of our cancer plans or strategies address environmental or occupational risk factors for cancer. And the big question is why? Why don't they? Probably for the same reason we can't find any mention of REACH on their websites either. They don't see it as part of their remit. Everything is very segregated: health, occupation, chemicals, and we know that it all impacts on us and our health. Or else maybe they refuse to see the connection. We've been told that it's down to lack of capacity. We've been told by a breast cancer charity they don't have the capacity to cover environmental or occupational issues, and it's been easier for them to tackle actually the lifestyle risk factors But for me, this is totally unacceptable. And why, when the WHO, who is the global authority on health, makes a request that you would put cancer prevention into your plans, why would you presume to know better and ignore them? And it's not just the environmental and occupational factors they ignore. It's the science as well, which supports occupational and environmental risk factors. It never seems to be good enough. Whereas the science that supports the lifestyle risk factors always seems to be the right kind of science by the proper kind of scientists. And it never seems enough. The WHO, the Royal Commission, the EU, it doesn't matter who it is, it's never good enough. And by not acknowledging the numerous reports, all the research papers, all the science, our response to breast and other cancers in this country is based on outdated science. We are in the scientific Jurassic when it comes to addressing cancer prevention, when it comes to exposure to chemicals that are toxic in our homes, in our workplaces, or in the wider environment. In the early 2000s, we were called to a meeting in Brussels by Margaret Wallström. She was the European Commissioner for the Environment and the instigator for the REACH legislation. There was representatives from all the European women's organisations there that were working on issues to do with health and environment. And she really wanted to engage us from the very start in the REACH process. So we felt some kind of ownership, and that we would be consulted, and we would also go back to our own countries and push the legislation forward in our own countries. In its original state, REACH was a very feminist piece of legislation. It advocated to protect human health and the environment, and to ensure a more effective implementation of the precautionary principle. I was wondering why I felt this so personally. It really cuts me to the core when I read the other day that the minister responsible for chemicals policy, Theresa Coffey, said REACH is some kind of threat to our parliamentary sovereignty and supremacy, and the supremacy of UK courts. She believes we should not stay in REACH. So this is what the protection of health of citizens, consumers and workers boils down to for this government sitting over there right now. It boils down to sovereignty and supremacy. We need REACH for breast cancer prevention, basically. And the depressing fact is, even after decades of lifestyle-focused initiatives, the rates of breast cancer have not decreased. Since the 1970s, breast cancer incidence rates have increased by more than half, 54% in the UK. I've even seen figures that suggest it's higher. And for breast cancer specifically, 1 in 8 women in the EU 28 will develop the disease in her lifetime, and the total economic cost is reckoned to be £16 billion. So neither morally or economically can we afford these rising rates. Yet still, each October, the breast cancer charities tackle the so-called lifestyle risk factors, calling for awareness, running for pink, and raising billions for the cure, and we are still no further along with preventing breast cancer. Yes, we have better treatment. Yes, fewer women are dying, and this is really good news, but we still do not have safer detection methods, and still the rates of breast cancer continue to climb. I have lots of questions, but very few answers.
Yeah, carry on.
Why can't we have awareness about better treatment, safer detection, and primary prevention of cancer? Why is it ignored? Why has the diet, exercise, and alcohol mantra never changed in the last 30 years? Why do breast cancer charities willfully ignore the environmental and occupational risk factors for breast cancer? Since 1995, we've been calling for a strategy on the primary prevention of breast cancer.
To place breast cancer in all of this, I think the representative from breast cancer now has left, but to be able to take it out of what is to some degree a bit of a ghetto, you know, it's there, and the whole, in a sense, the strange thing about Brexit is the opportunity that it does afford to raise this whole spectre of chemicals in the workplace, at home, in the wider environment, and how it makes us ill.
Yes.
We have this from pre-birth, from the womb to the grave. It is this lifelong, low-level exposure to this chemicals cocktail that nobody's taking account of, and absolutely no way do the breast cancer charities take account of it. So to be able to fold the breast cancer, the pink, the October moments into this wider story is, it is a strange kind of an opportunity.